pathology and the duodenal pathology and the pancreatic pathology not only. It's important to remember that from histological pathology and the duodenal pathology the main and layers, pancreatic pathology all the it's important to remember that from histological pathology and the duodenal pathology the serous layer. And if it's we want to remember a few things about the physiological roles of the bile secretion, it's important to remember that the bile secretion, the bile inhibits the fermentation flora, is very, very important in order to understand that all the pathology regarded or linked with gallbladder and bile ducts pathology. It's important to understand that all the disturbances of the flora can be affected by this type of pathology. Has an important peristaltic activity. This is why in case of a different type of dyskinetic changes, we register important changes of the peristaltic activity, have a very important antiputrid role, also a cholagogue and antibacterial action. It's important to remember that from this point of view that the concentrates the bile pigments, very, very important, and also the bicarbonate secreted in ductal cells has an important role in buffering the duodenal environment, if we can say so. For example, in dogs, the daily liver production of bile is between or starting from 400 up to 800 milliliters, but it's important to notice that the normal capacity of the gallbladder is about 40 up to 60 milliliters, okay? The biliary salts are very important, and their main role is are very important in fat emulsion, are very important, these salts, in activation of lipase, also facilitate the absorption of fat soluble vitamins, and also, as I told before, stimulates the peristaltis. The bile secretion, it's important to understand and to approach it and to understand it and to have in mind all the time when we are examining the dog with a digestive or hepatobiliary disorder, that the bile secretion is self-sustaining through a positive feedback mechanism provided by the cholinergic effect of bile acids. I probably, but it's my duty to try to remember during our colleague will join us. Also, it's important to remember you that the bile content, the chemical composition of the bile, and the composition consists, in fact, in water, mineral salts, bile acids, and pigments. It's important to know that the electrolytes, fatty acids, cholesterol, carbohydrates, lipids, protein, mucin, and of course, pigments, bile. It's important also to understand as a chemical composition that the hepatic bile is isosmotic compared to plasma, and as a density is between 1,010 and 1,035, and its pH is alkaline, and as regarding the taste, it's a very intense, bitter taste, and this is very important to understand probably the effects and the involvement in their specific physiology. The main biliary acids are the cholic acid and chenodeoxycholic acids. These are synthesized from cholesterol in the liver, and the conjugation is performed with glycine or taurine, and their secretion, of course, take place in the bile, that. And after that, by combining them with sodium or potassium, the glycocholates and sodium and potassium taurocholates are formed mainly, and the most important are called as biliary salts. Regarding the composition of the bile, we have in this chart the graphical representation of the proportion of gallbladder compounds. And of course, the most important, it's important to notice that the bile salts, in addition to protein, bilirubin, and cholesterol, are the main components of the bile secretion. Regarding the motility, also it's very important to understand in approaching the clinical approaching of the patient with hepatobiliary disorders or in digestive disturbances, The motility of the gallbladder is controlled by the contraction of his specific sphincter or the sphincter, and its relaxation following the penetration of bolus at the duodenal segment, duodenal level, and the release of cholecystokinin, which is in fact responsible for the contraction of the gallbladder. It's very, very important to understand this and to have in mind all this. Okay, this small introduction, I hope it wasn't so boring for you. And I would like to try to discuss together the most important pathologic aspects and the gallbladder pathology. We will start with for the beginning with the easiest form, with the presence of biliary sludge. A few general considerations. It's important to know that this biliary sludge is well defined and can be defined as an increased consistency of the bile content, and can be translated in normal words appearing as a bile mud. In case of the presence of sediment, these consist of cholesterol crystals, mucin crystals, different salts, especially calcium salts, and bilirubin, and of course, other components. It's important to notice and to understand from epidemiological point of view that we can talk about an increased incidency and prevalence in adult dogs and in elder dogs, very, very important. And in cats, the gallbladder biliary sludge has been reported in a lot of liver diseases, especially those which affects the biliary common ducts or the biliary tract. It has been suggested that the gallbladder or the biliary sludge may be more significant or more likely associated with disease in cats compared to dogs, correlated with clinical expression. All the study or the papers in this idea can sustain my hypothesis and my idea. Of course, the biliary sludge has a very high prevalence and persists in healthy dogs. It's important, but in healthy dogs, we can register this change and the presence of this bile mud, the biliary sludge, in normal clinical point, in normal dogs. Okay, general considerations. It's important to understand the main contributory causes. We can talk here in developing an appearance of the biliary sludge. We can talk about the involvement of different abnormalities of bile secretion into the liver, of course. And in addition to these, can be combined or separated with the gallbladder hypomotility. Regarding the gallstone formation, it's well known. All of us probably know that in order to develop such pathologic conditions, the cholesterol stones and, of course, excedentary or addition cholesterol secretion in addition with insufficient bile production can be responsible for appearance and development of the biliary sludge. Few words about the clinical expression, the clinical science. Of course, in cats, in most of the cases, the presence of biliary sludge is correlated with the presence of clinical expression. We can talk here in accordance with the prevalence, important changes of the appetite, which can be described as a decreased appetite up to anorexia. Of course, the owner report us especially important weight loss, dehydration, of course, vomiting. You see, all these are in important percentage here. And of course, dehydration, vomiting, and changes of the appetite. In addition to jaundice, also diarrhea, of course, abdominal pain, and all these are very important in order to approach the diseased patient. But it's important to know and to remember you that the biliary sludge in dogs, it's very often without clinical expression, often develops asymptomatically. We can talk in dogs about a medium intensity colic, sometimes vomiting from time to time, okay, and bile vomiting. It's very important and is specific for this type of vomiting and the aspect of the material. Of course, it's important in order to suggest us the diagnosis. Regarding the diagnosis, uh, from my point of view, and of course, in accordance with the specific literature, the method which establish a specific diagnosis of the biliary sludge is ultrasonography. Ultrasonography, of course, it's important and distinguished by a few advantages. It's important to remember it has no contraindications. It's a non-invasive technique. And of course, in addition to these, the examined organ can be viewed independently of the functional state of the liver or the gallbladder. Okay, it's important to remember that ultrasonography is considered as a first-line imaging examination in case of patients with biliary disorders, with biliary dyskinetic condition, in case of liver diseases or pancreatic disorders also. In order to sustain my words, I've tried to put you some articles, some papers, in order to offer additional bibliographic papers or theories in such cases. It's important to notice that for examining using ultrasonograph machines, the gallbladder, it appears as a round-shaped cavitary organ with anechoic content, with a very, very thin wall, uniform thin wall. And in case of normal patients, it's important to remember that the content is anechoic, it's homogeneous, and it's specific for the normal aspect of the bile, and also the wall. It's also important to be approached from ultrasonographic point of view. It's important, in addition, in order to evaluate correctly the diagnosis and the gallbladder, in order to eliminate the artifacts, when the ultrasound wave is directed deeply ventrally, of course, it's normal that the gallbladder disappears and appear in our image the right lobe. When the ultrasound wave is directed dorsally, of course, we can we can find the portal vein, which appears in our ultrasonographic image. And of course, after that, the left lobe of the liver, it appears in our image. I told you before that in case of biliary sludge, we can see into as a content, and the content can register changes, appear as stratified. Sorry, appears as stratified in our image. Sorry. Okay. Okay, as you can see. And in assessing the bladder, the gallbladder, it's important to know that the adjacent lobe artifact may give us in our image the false impression of bile sediment. It's very, very important to avoid this wrong approaching from ultrasonographic point of view. But also there are cases in which the sediment appear as hyperechoic and well-formed without evidence of its mineralization. Is normal, and this type of situations are very frequent, very often registered in ultrasonography. But this pathology, it's important to notice and to be correlated with the clinical expression, with the clinical signs of chronic gallbladder infection, for example. Regarding the diagnosis, I told you that we can see. Sorry, what's happening with my image? Okay, we can register no acoustic shadow, no distal shadowing. We can find into the lumenum, the content. We can register different crystals with diameter between 1 up to 2, even 3 millimeters, which can appear into the content in the lumenum, and of course shows movement flow. It's very important from this point of view to be understood. Okay, the appearance of the biliary sludge, okay, I told you before that appear as a mud, with the presence of some components, some are not artifacts, are some dots, which change the normal aspect of the anechoic normal content of the gallbladder. And in such cases, we can register even masses or pseudo masses, which can suggest as a different pathology, but for sure, it's important to make the differentiation between these. In very many cases, into the gallbladder, the content can be changed. I told you a lot of dots. We've changed the normal appearance, the normal anechoic appearance of the gallbladder. In addition, with most or less important changes of the gallbladder wall, in many cases we can see parietal reactions where the wall became a little bit thickened, okay, but it's important to notice that the architecture and the specific architecture of the gallbladder wall are respected. Also, I told you it's important to have in mind all the time the aspect of the wall, of the content, and the contractility and the tonus. In addition to these general coordinates, in addition to the echographic pattern, the biochemical parameter in case of biliary sludge, it can express and can show us a lot of changes. In very many cases, we can register increased values of different and some parameters which can be recorded, but it's important to notice inconstant presence and with no obvious clinical or paraclinical significance. We can register elevated levels of activity of the alkaline phosphatase. We can register raised level of glutamyl transferase, and also in addition to these, the most important enzyme activity, the alanine aminotransferase is also registered with important changes and elevated levels. Also, the changes of bilirubin, cholesterol, and so on. In addition to these, in order to sustain my presentation, I recommend you some articles, some papers regarding the prevalence, the risk factors, and biochemical markers in dogs with ultrasound diagnosed before biliary sludge. It's important to notice that the differential diagnostic using ultrasound machines, it's important to be performed between the gallbladder sludge and the gallbladder mucocell, which we'll talk later about this, have a specific pattern, a specific aspect, and its appearance is of kiwi, when we can talk about an enlarged gallbladder with dilated bile ducts. Of course, when the gallbladder moves, the bile content is fixed. It's important from this point of view. When we're compared with the gallbladder sludge, when we can talk about the appearance of stratified ultrasound without acoustic shadow, and of course, with slowly moves to the inordinate or independence with the gallbladder in case of flow. Let's see now in few words about the biliary sludge evolution, because I told you in very many cases in normal patients where when they come for a normal screening, ultrasound screening, or in case of a general examination of the abdomen using ultrasound, in very many cases have no clinical or obvious significance, but let's see which is the evolution of the biliary sludge. In most cases, we can talk about self reabsorption or self-remediation by reabsorption. In very many cases, we can talk about triggering different additional pathology being responsible for triggering the angiocolitis. Okay, we can register in evolution even the inflammatory condition of the gallbladder, talking here about the cholecystitis, when the biliary duct is in order to be responsible for injuries of the biliary duct or the biliary ducts or the common duct, we can talk about even inducing about, in very many cases, even of appearance and inducing of acute pancreatitis. In many cases, being responsible for gallstones and so on. But probably you know all these, and in your private, in your activity, after using your experience, you registered in evolution a lot of similar cases. We have here few images, different aspects of biliary sludge, organized or non-organized. And few words, if you are interested, few words about the therapeutic approach of the biliary sludge. We can talk here the most important, the dietary treatment. Here we can talk about the offering to your patient a low fat diet, very, very important, this diet or dietary treatment. In addition to this, the therapeutic approach have to be followed by cholinergic and cholagogue drugs, substances. We can talk about specific or non-specific from human medicine or specific for veterinary medicine, different products, okay, in order to have a specific action to enhance the production and in order to enhance the contractility of the gallbladder. And also, it's important to recommend different symptomatic therapy, even antibiotics, in addition to spasmolytic, analgesic, or anti-vomiting drugs or substances. If are any questions, if you want, we can talk about and to answer to your questions now, or we can continue my presentation and to answer to your questions to the end of my presentation. Alex?
Well, I think the best thing to do is to have all the questions at the end of the presentation.
Thank you, Alex.
Step by step, 300 people with us, and I have a lot of questions on my phone, but the presentation is really catching, and we should finalize the presentation first.
I really appreciate it, and thank you for your recommendation. We will continue with the next step of my presentation with a different and another aspect. We can talk about the biliary dyskinetic condition or biliary dyskinesia. It's also an important medical condition. It's a condition of the gallbladder expressed by different disorders of the tonus and of the motility of the gallbladder. Of course, depending on its origin, this biliary dyskinesia can be classified as a primary one caused by neurohormonal imbalance, okay, being triggered by different dysfunctions, vascular or vegetative dysfunctions. And the second type, it's a secondary visceral type, appeared reflexively, of course, in the case of pathological conditions of the different digestive organs. We can talk here about the chronic duodenitis. We can talk here about persistent or chronic enterocolitis. We can talk here about the inflammatory condition of the biliary duct, extrahepatic biliary duct, and so on. But in this medical condition, we can talk here as main causes of different hepatocyte dysfunctions, of course, in accordance or regarded or followed by a change in bile composition. Of course, it makes sense what I'm telling you now. And when we are talking about different neurovegetative disorders or dysfunctions of the gallbladder wall muscles, remember all the three layers of the gallbladder wall. And in addition to this, may be responsible for this disorder of hormone secretion in the bile. In all these cases, we can talk about important changes of the main bactericide properties of the bacterial population into the intestine, being responsible for changes of the bacterial environment from the intestine, responsible for dysbiosis and intestinal dyskinesia. Can be associated with an important reflux of intestinal content into the gallbladder, and try to understand from this point of view that the next step is inducing an appearance of cholecystitis, also an important and severe, very severe medical condition in dogs and cats also. Regarding to this, it's important to know and to talk together about the diagnostic criteria for functional biliary sphincter or body disorder. We can talk here from point of view and paraclinical, from clinical point of view, the presence of biliary pain. Important to notice from the lab, we can register elevated levels of the liver enzymes. We can talk here about the absence of bile duct stones or other wall changes or structural pathology. And in addition to these, as supportive criteria, it's important to notice that in such cases, we can talk about the normal activity of the amylase and lipase enzymes. Also, we can perform, and we can see in case of when it can perform, and then you have the possibility to perform scintigraphy, of course, we can register abnormal hepatobiliary scintigraphy. Also, in case of gallbladder disorders, regarding to the volume, not only from clinical point of view, also we will register that our patient will accuse, will show us, will express biliary pain. Also, we will see the absence from ultrasonography point of view, the absence of gallstones or other wall pathology, wall changes, or other structural pathology. In order to this, as a supportive criteria, of course, we can recommend and perform gallbladder scintigraphy when we can see a low ejection fraction. And in addition to these, only in case of gallbladder disorders as the main causes of the biliary dyskinetic condition, the normal activity of the liver enzymes, also normal activity of amylase and lipase, and also the level of bilirubin remain unchanged. In order to sustain and in order to confirm this, in order to support my idea, you have, and I can recommend you this article, this paper. Okay. It's important to understand and to remember you and to pay attention to this idea that the clinical signs, the clinical expressions, and the symptoms of biliary type pain in the absence of other etiology can be considered as a main hallmark of biliary dyskinesia. Because you know, and I would like to focus on this idea, that the biliary pain is well known and is described as pain located in the epigastrum and in the upper quadrant with the following expression or changes. Okay, builds up to a steady level and lasting up to 30 minutes or more. It's important to notice that these signs appear at different intervals, but not daily. It's important to know. But this pain is severe enough to interrupt daily physical and other emotional or other type of activity, or lead to an emergency consultation and the presentation of the owner with the patient to room visit. But it's important to know that in not all the cases is not significantly related with the bowel movements. Also, in addition to this, is not significantly relieved with postural changes or specific suppression of the gastric juice, and not only. In addition to this, I would like to point out the classification of the biliary dyskinesia and their clinical aspects. When we are talking about a hypertonic biliary dyskinesia, of course, we will register to our patient an obvious upper abdominal pain. We can register a very important, up to severe dyspeptic syndrome, and of course, the obvious signs of vegetative dysfunctions. On the other hand, in case of hypotonic biliary dyskinesia, we can register the presence and register even to the palpation, the presence of hepatomegaly using palpation, of course, or using ultrasound examination, the vomiting, important changes up to important decreasing of the appetite, pain in the upper abdomen, and of course, in addition to the presence of dyspeptic syndrome, very, very important. Few words about the paraclinical aspects of biliary dyskinesia. The hematological parameters do not indicate important changes. And from biochemical point of view, we can recommend alkaline phosphatase activity, the level of globulin and albumin into the serum, and of course, the level of activity of alanine aminotransferase, and in addition to bilirubin. Of course, and evaluation using ultrasound machine of the upper abdomen. Few words about the treatment. The treatment of biliary dyskinetic condition of the gallbladder. In first case, in case of hypertonic biliary dyskinesia, it's important to notice that good effect and good result we can obtain only using the diet, with the recommendation of small and often meals offered to our dog or cat, 5 to 6 meals, but of course in small quantities. But in addition to spasmolytic drugs, and can recommend here drotaverine, caroverine, scopolamine as active substances, and in addition to these, of course, cholinergic substances in order to obtain an important contraction and to make the bile proper in order to be ejected from the gallbladder. On the other hand, regarding the treatment of hypotonic biliary dyskinesia, also 5 to 6 meals in small quantities, but here we can recommend here prokinetic drugs, prokinetics. Here we can, with good results, we can recommend you oral or parenteral therapy with metoclopramide, domperidone, and so on, and also natural choleretics. Okay. Let's see now which are the pathogenetic consequences of the biliary dyskinesia. Of course, we will continue and we will try to understand that the presence of biliary dyskinesia can be responsible for the appearance and registering the biliary sludge. I told you before in my first part of the presentation, which is followed in very many cases with inflammatory conditions of the gallbladder, of cholecystitis. And also can be followed by the presence and developing of gallstones, and last but not least, with the biliary mucosal. Okay, I would like to present you and to try to put together a few ideas about the inflammatory conditions of the gallbladder. We will talk a few words about the cholecystitis. Probably it's easy to understand and to be defined as a medical condition representing the inflammation of the gallbladder. Okay, and also in addition to these, as a continuing process, the inflammation of the extrahepatic bile ducts, well known as under the name of angiocolitis. But regarding the cholecystitis, it's important to understand and to notice, please keep in mind this idea is thought to be caused in very many cases, in accordance to the specific literature, is mainly caused by the reflux of intestinal bacteria into the bladder, into the gallbladder, of course, via the bile ducts, or is described the hematogenous way and hematogenous entry of the bacteria from the adjacent hepatic circulation. In such cases are involved gram-negative bacteria. We can talk here about Escherichia coli. We can talk here about the Klebsiella, the Enterobacter, Proteus, and Pseudomonas, which are the most often registered and isolated in case of canine bacterial cholecystitis. But we can talk about the presence of anaerobic bacteria such as Clostridium. Probably you know and remember the secondary step and the clinical expression, which is totally different in case of acute cholecystitis compared with the chronic cholecystitis. But we will talk all about this. Regarding the pathogenesis, we can talk about the specific emphysematous cholecystitis, of course, due to the involvement of Escherichia coli and Clostridium is very often, or I can say so, it's registered especially in dogs. But notice that this emphysematous cholecystitis is associated in some cases with the presence of with diabetes. It's important to know. Also, regarding the main cause, the responsible cause, we can talk about the non-necrotizing cholecystitis, which involve or non-suppurative, or in other cases, but in less cases, suppurative inflammatory condition. These are associated with the presence of different infectious agents, or in addition to these, we can talk about different systemic disease or even neoplasia. Also, this last type of cholecystitis may reflect abdominal trauma, may reflect gallbladder obstruction by different causes, occlusions of the cystic duct in case of inflammatory condition, in case of neoplastic condition, or in other medical condition. In case of necrotizing cholecystitis, this one is diagnosed and it affects middle-aged to older adult dogs, but this one can be registered and can be developed secondary to thromboembolism, can be registered after blunt abdominal trauma, in case of bacterial infection, cystic duct obstruction, and so on. But we will lose. I don't want to take your time with these main causes, but can be also as a result of the extension of an inflammatory condition or of the inflammation, or even after can follow a neoplastic process from different adjacent structures, especially hepatic tissue, okay, which also may be an underlying cause. Okay. Also, this medical condition can be followed by the with or without the gallbladder rupture. So that means that can be represent an important medical, even an emergency condition, or can be developed and appear as a chronic syndrome in very many cases associated with local adhesions between the gallbladder wall, with omentum, adjacent viscera, and so on. It's important to remember and to notice that the gallbladder epithelium, of course, in all the cases, it's recognized as a robust tissue, but this one is continuously exposed to one of the most dangerous agents in the body. Try to remember and all the time to have in mind that a concentrated solution of bile acid detergents, okay, are present in this cavitary organ. Regarding the pathogenesis, try to follow the idea that a prolonged stasis with a concentrated bile, which stagnates into the gallbladder lumen, it's responsible for different clinical and pathogenetical changes, starting with anorectic patient, of course, in accordance with chemical injuries to the gallbladder, which can be also registered. But in case of ascending bacterial infection, which is very often registered and is possible, and very often commonly found in case of old or advanced extrahepatic biliary stasis, can be also a main cause of the cholecystitis. Also, as a main cause or an important cause is the gallbladder wall ischemic condition, because having only a single source susceptible to ischemic necrosis following the states of splanchnic vasoconstriction, of course, is enough to develop an important edema or an inflammatory condition at this level. But it's important to notice, in addition, that compared with humans, in human medicine, the studies showed that the capillaries barely filed in an alithiazic acalculous cholecystitis suggest that an important alteration of the microcirculation of the gallbladder wall plays an important role in its pathogenesis. In order to sustain this, try to consult, try to look for this paper and to understand this. Regarding the diagnosis, the paraclinical changes, the hematology reveals a lot of changes, a lot of non-specific changes, abnormalities. We can find patients with anemia. We can find inflammatory response such as leukocytosis. But probably, and the most important changes are the specific biochemical panel. And we can talk here about the elevated levels of the specific enzymes. We can talk here about an increased level of the activity of alanine aminotransferase, also the other, all the transaminases, aspartate aminotransferase, gamma glutamyl transferase, all of them are registered to be elevated in different degrees, in addition to changes and elevated or increased level of alkaline phosphatase, increased level up to 0.6 milligrams, 0.6 milligram per deciliter of the bilirubin, important elevation over 300 milligrams of the cholesterol, and so on. But when you perform urine analysis, also in addition to these, we can register important presence and levels of bilirubinuria. Using ultrasound machines, or the ultrasound technique is very effective, very efficient in order to put diagnosis. It doesn't matter the type, starting with a normal probe, using a normal ultrasound machine, with a 5 up to 7, 6, 7.5 megahertz frequency, you can register, you can see very easy, very easy the changes, the wall changes, the structure, an important thickness of the gallbladder wall, and so on. But from this point of view, I can say that ultrasound is the preferred technique for the first stage of diagnosis, for observing the gallbladder, for evaluating and observing the biliary tractus, because this technique I told you before is a non-invasive one. It's very safe, it's fast, and it's cheap in very many cases. Okay, the ultrasound examination of the biliary system in general is recommended and it's indicated to rule out extrahepatic obstruction in case of jaundice, in case of patient with jaundice, in order to detect the presence of biliary stones, in order to detect the presence of masses, okay, to this level, to the gallbladder level, to the liver level, and so on, and in order to show us, to display the most characteristic and specific, the wall thickening of the gallbladder. It's also very important for the diagnosis. It's useful to make differentiation between biliary obstruction of hepatocellular disease, of course, in case of when the activity of the specific enzymes, serum biochemistry data are without any possibility of equivocal. As you can see, in my presentation, I wanted to show you, to put some images of acute cholecystitis. As you can see in my image, it's a very old image. It's for about 11 years, from 2009, sorry. As you can see, performing the ultrasound examination using a normal probe of 5 megahertz frequency, you can see the changes of the gallbladder wall. You see a thickened wall, but it's important, and it's the most important condition. You can see that the inflammatory condition and the thickness, it's important, can be noticed, but this condition is associated in case of inflammatory disease. It's important to notice that affects all the gallbladder wall, affects, and the architecture, the specific architecture of the gallbladder wall is maintained with, you can identify very easy the interface between the content, the bile content, okay, with the mucosa, of course, the edema of the mucosa, and all the layers of the gallbladder wall. Okay, here's transversal section, longitudinal, also longitudinal. When it's piriform, here is round shape. And all these cases, you can see that the gallbladder content is non-homogeneous. Okay, we can see the presence of the dots, okay, desquamated cells, okay, inflammatory and other micro particles into the content. Doesn't matter if we are using, I told you, the incidency, the transverse or the longitudinal when it appears in his specific aspect. But probably all of you which are dealing with ultrasound technique and ultrasonography and ultrasound machines, these parietal changes can be very easy to be detected, to be identified using a normal, of course, it's recommended to use a high frequency probe of 10, 8, 10, 12 megahertz, of course. But if we have only a 7.5 megahertz probe, we can evaluate and we have the proper diagnosis. Few words about the treatment of cholecystitis. Of course, in this case too, we can talk also about the dietary treatment and the drugs using for the treatment of cholecystitis. It's important all the time to have in mind that in case of cholecystitis, when we have a morphologic and when we have a functional change of the gallbladder, the diet, it's important. It's important to recommend and to offer to our diseased patient low-fat diet with a high quality content in protein. And of course, it's important to notice, because all the changes of the intestinal function, it's important to offer and to use and to recommend food with increased digestibility. Regarding the medicines, regarding the drugs, it's important to limit, to reduce, and to control the colics the colic from the cholecystitis using spasmolytic substances, recommending here NOSPA, spasmolytic such as drotaverine, I don't know, caroverine, scopolamine, even atropine, or in severe cases, we can recommend even tranquilizers. But this main spasmolytic, very common in Romania and probably not only, spasmum and NOSPA, or buscopan or atropine, you can use them without any problem in normal and recommended doses. And in order to prevent the infection, we can use administration of antibacterial substances, even in cases when you are not so sure that in that place is an important involvement of the bacteria in order to develop this inflammatory condition. Because I told you, when the physiological condition is not maintained, we can talk about the presence and aspiration of intestinal content into the gallbladder, and for sure this can be responsible very easy and very fast for the presence of bacterial infections. Okay. I would like to continue with another gallbladder medical condition. I would like to continue with the cholelithiasis, or the gallbladder stones. Okay, let's see what's happening in such medical conditions. The gallstones is the very often used term for the presence of stones from the gallbladder, the gallstones, which defines the presence of different mineral formations into the gallbladder or into the bile ducts. But it's important to remember and to know regarding their composition, consisting of calcium salts. We can talk here regarding to their composition, the mineral contents, in addition to the presence of cholesterol, stones, bilirubin content, which are deposited on a very proper or favorable substrate. Here we can talk about the presence of cellular debris. We can talk about even the presence of parasites, and in most cases, or in the most often registered and analyzed cases, the presence of mineral salts. It's important to notice and to understand that the main factors, favoring factors in appearance of gallstones, in appearance of cholelithiasis, is represented by the stagnation, the biliary stasis, and in addition to this, the inflammatory reaction of the bile ducts wall, of course, occurring with a higher frequency in dogs, and especially in small breed dogs. But it's important to notice, in addition to this, that the cholelithiasis and the presence of gallstones can be a surprise after or during performing the ultrasound examination, because in many cases, the most gallstones in dogs and cats are clinically silent. And in case of clinically silent situations, the owner cannot suggest or express or tell us about any digestive changes, appetite changes, or other, I can say, from this point of view, different changes or other clinical signs, etiologic or etopathological changes, or behavior changes, changes in their patient. Regarding the stones, the choleliths, these are diagnosed and registered in middle-aged to older animals, and it's well known, very important to notice, and all the papers are underlined and present this idea that a higher incidence of these stones is registered in small breed dogs, are more often registered in case of miniature schnauzers, in poodles, in older animals, and especially regarding the sex, in females. But it's important to notice that the stones, the calcium stones, are registered in cats and much more rarely registered in dogs, because in dogs, the canine gallbladder absorbs calciums. This is why these calcium stones or gallstones, based mainly from chemical point of view on calcium as a composition, is registered in cats. In dogs, most of them, these gallstones contains, and also in cats, contains calcium carbonate and calcium bilirubinate pigments. And these can be defined and considered, of course, pigment stones. These pigment gallstones are divided in two types, in two categories: black pigment stones. Of course, these are composed mainly of bilirubin polymers, which reflects a prolonged hyperbilirubinemia, and brown pigment stones composed especially from calcium bilirubinate, which is associated with chronic or recurrent bacterial infection or changes of the motility of the gallbladder, especially the biliary stasis. Let's see what's happening in next stages with the specific pathogenesis of the gallstones. It appears, especially as a result of the imbalance of cholesterol, phospholipid, and bile salts, which can be continued, and in addition to this, to be responsible, the precipitation of microliths or microcrystals of cholesterol. These microcrystals, especially of cholesterol, are followed by their aggregation, and the end is the formation of cholesterol gallstones. It's important to notice, and in my image have all these idea, okay, the changes in synthesis of bile acid, in addition to biliary dyskinesia. And next step is bile stasis, followed by form soft gallstones, and after calcination, of course, the presence of gallstones, which can be easily diagnosed using ultrasound machine, and in later stages can be detected using X-ray technique. Regarding the clinical expression, the symptomatology, it's important to notice that in such cases, the abdominal pain and the colic syndrome is well expressed, but mainly considered with different or variable intensity. But from my clinical experience, I can say that in many cases, the pain is well expressed. Very often, the owner present as the often presence or the frequent vomiting of their patient. In case of jaundice, in the presence of jaundice, it's registered the progressive exacerbation of jaundice, of course, due to the impossibility and of stone elimination and disturbances in flow of the bile content. Regarding the diagnosis, it's seems to be very difficult only using clinical approaching. It's important to perform also in these cases ultrasound examination, and in order to confirm the presence of these stones into the gallbladder, it's important to evaluate this medical condition in dynamics, because I told you it's a non-aggressive technique and you can perform this exam even daily or 3 times a day, doesn't matter. But it's important to know that in ultrasound examination, in ultrasonography, the stones have a specific characteristic aspect of hyperechoic mass, hyperechoic formation, okay, located intraluminal, located into the gallbladder. Of course, the most important things to be recorded, the presence of this hyperechoic mass into the gallbladder in case of stones is followed by the specific posterior or distal shadowing, the presence of acoustic posterior or distal acoustic shadowing, which is specific for stones. And of course, it's based mainly, in addition to these, is based on biochemical analysis, important up to moderate increases of the specific transaminase activity, aspartate aminotransferase, gamma-glutamate transferase, and alkaline phosphatase, and of course, important changes of the level of cholesterol in such cases. As an idea, I would like to present you a few images of the cholelithiasis. We can see here important changes of the gallbladder wall, of course, due to the continuous irritation, due to the presence of these small stones into the gallbladder. Of course, the continuous irritation is responsible for secondary inflammation of the gallbladder wall. Also, in this image, we can see, okay, the little, very not so obvious affected wall of the gallbladder, but you can see that the content of the is not homogeneous, is not anechoic. We can see the presence of some dots into the content, into the lumenum, and of course here in the distal part of the gallbladder, we can see the gallstone, which with round shaped, of course, with distal, with lateral shadowing, and of course distal shadow specific aspect. Also, you can see in this image the diaphragm, the liver, the gallbladder, and the presence with discrete distal shadowing. Also in this image, we can see the presence of two stones in the bottom of the gallbladder, and so on. Few words about the treatment. In such cases, already in case of the presence of gallstones, we cannot talk only about the diet or the dietary treatment. We can try and to recommend and to give to our patient drugs, specific medicines, in order to control the pain, the colic. We can recommend and use spasmolytic drugs. We can recommend drotaverine, Nospa, caroverine, spasmin, scopolamine, scobutil, buscopan, atropine, or other medicines, even tranquilizers. And of course, because we can talk about the specific irritation and the inflammation of the gallbladder wall, the secondary cholecystitis due to the presence of the gallstones, it's important to recommend preventive or therapeutic antibacterial substances. We can, in case of lack of response, we can, in next steps, we can recommend a surgical treatment, because in case of multiple small stones presence, a diet with choleretic and cholagogue medication can be followed by success for healing and reducing the clinical expression. But in case of huge or large stones, the only method, surgery, can be recommended and performed by cholecystotomy or cholecystectomy. Of course, I'm not a surgeon, but the specific literature recommend cholecystectomy with the entire gallbladder removed, okay, or cholecystoduodenostomy with gallbladder replumbing. I told you I'm not a surgeon, but in most cases, it's important to look for the opinion of the surgeon. I would like to present you, in addition to this, another medical condition, very often registered, and in very many cases responsible for misdiagnosis. In very many cases, we can see the image, we can see important changes of the gallbladder wall, we can see a huge, thickened gallbladder wall, and you say, oh, it's important, it's an inflammation, it's a cholecystitis, it's a very severe acute gallbladder inflammation. No, in very many cases and in a lot of medical condition, you can see, we can register different, the wall edema, parietal edema of the gallbladder. In addition to this, in order to sustain my presentation, you can see, in addition to these, some articles, some papers. It's important to notice that when you will see in patients presented for general evaluation, for emergency conditions, or for, I don't know, a lot of other medical conditions presented for ultrasound examination, when you will see the wall edema, the parietal edema of the gallbladder, it's important to have in mind and to think that in addition to this, or the gallbladder, this edema, the gallbladder wall, it's registered in all shock situation, in all cases of shock, in all shock conditions, in all decompensated cardiac failure, in all immune, or in mostly, in many of them, in immune-mediated diseases. Okay, this parietal edema is well known as the gallbladder halo appearance or sign. In addition to this, it's important to notice that a lot of studies also make a direct connection between this specific sign, this specific appearance, this specific pattern of the gallbladder wall, which is connected with the gallbladder wall changes with the congestive heart failure. It's important to know this, and in order to understand this, I can recommend this study from my presentation. I told you that this edema of the gallbladder wall is, you can see, is specific shape, specific appearance, specific pattern of the gallbladder wall, which give the appearance of a double wall gallbladder. As you can see, doesn't matter of the type of or the position of the probe, this double or the halo sign of the gallbladder wall, it's important. Have in mind, and when you will have on your examination table a patient with this aspect, try to understand and to have in your mind it's in a very severe medical condition, and have in mind anaphylaxis, shock anaphylactic, all these shock or all the types of shock. When you see this image, you have to think and to explain to the owner that this aspect is in very, very many cases associated with a very severe medical condition. Last but not least, but a few words before the gallbladder tumors, we will talk about the gallbladder mucosal. Also, until in my experience of more than 20 years of ultrasound examination, I saw, of course, a lot of gallbladder mucosal. But the specific literature and the specific veterinary studies only in last decades present us more specific problems regarding this subject. Regarding the gallbladder mucosal, okay, this one is defined and characterized by a progressive accumulation of tenacious, pale yellow, or up to, of course, up to dark green bile, mucin-laden bile, which may extend into the cystic, hepatic, or even in common bile ducts, resulting in different degrees of bile duct obstruction. Is very important. After my experience and after my 20 years of activity in veterinary medicine and more than 20 years of ultrasound examination in dogs and cats, biliary mucosals are very, very, very rare. In my whole activity, I saw no more than 3 or maybe 4 cases of gallbladder mucosal in cats. In most cases, this gallbladder mucosal can be described and registered in dogs. It means, in fact, this gallbladder mucosal, an increased production of mucosal, mucin, because mucosal, this is the root of the word, express our pathogenesis of this medical condition, an important increasing of the production of mucin into the gallbladder, increasing its diameter. The wall appears thickened, okay, and the content is changed, became brown, even black colored. But it's well known, and the literature explains us that in case of prolonged treatment with prostaglandin may be responsible for this medical condition. In case of patients with prostaglandin, in case of females, reproduction females, which gets prostaglandin prolonged therapy. But as segmentation, as the next stage of the presence of mucosal, of course, the next stage is the rupture of the gallbladder wall, the rupture of the mucosal, because it's very easy to be performed and to be registered this medical condition, be responsible for the biliary peritonitis. It's important to notice that in very many cases, this gallbladder mucosal can appear and can develop asymptomatic without clinical expression, can be a surprise for ultrasound colleagues which perform ultrasonography, for ultrasonographies. In very many cases, it's accomplished, and it's in addition to a subclinical expression or without any clinical signs for a long period of time. But this gallbladder mucosal can be also appear and can be registered secondary to the bacterial infection, can be registered secondary to chronic inflammation of the gallbladder wall or secondary to the cholangitis. Okay, we can talk here about a lot of factors, predisposing factors to gallbladder mucosal formation. This one is in most cases registered in older age dogs, or in few cases, but can be registered even in middle-aged dogs, can be registered and diagnosed in addition with the presence of different endocrine disease, endocrinopathies, especially, please notice and have in mind all the time, when we see the presence of the gallbladder mucosal, check for the specific clinical signs for Cushing syndrome, for hyperadrenocorticis. Also, in very many cases of diabetes, we can register the presence of this gallbladder mucosal, which is very important to be noticed that in next stages can be, I told you before, can be followed than the specific rupture of the gallbladder wall rupture. Okay, can be in addition registered in accordance with many changes of the specific metabolism of the lipids in case of hyperlipidemia, in cases of hypercholesterolemia. But please notice that this hyperlipidemia and this hypercholesterolemia, it's registered in all cases of Cushing syndrome, can be registered in case of gallbladder motility changes, and of course in case of hyperplasic changes of the gallbladder mucosa. The red line for this idea, the predominant histologic feature of the gallbladder mucosal is the cystic mucinous hyperplasia. Please try to remember. From ultrasonographic point of view, probably all of you know that the specific appearance, the specific pattern of the gallbladder is Chiuc aspect. Okay, I told you before, in addition to these, I have, in order to support my presentation, a lot of papers, scientific papers, but please notice that the gallbladder mucosal is in very many cases correlated with three main diseases, with hyperadrenocorticis, Cushing syndrome, with pancreatitis, and of course, I told you before, with diabetes. Okay. The clinical signs, I told you, somehow are often non-specific or very, 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 I can say, not so well expressed, no well defined, abnormal, and from time to time episodes of vomiting, anorexia, changes of reducing or reduced appetite, lethargy of your patient. So this episode appear as a short period, a few days up to 1 week in most of the cases, but a more chronic, of course, with short lived response to antibiotic therapy it's registered and described by the literature. In some patients, some of them, the gallbladder mucosals have occurred in the absence of any clinical signs, I told you before. But notice that in dogs, especially in internal edges of the gallbladder, from ultrasonographic point of view, the wall and the content, the internal part, appears irregularly, and the presence of small predominant central nodule, which can be registered, okay, can be observed direct, I told you, towards the lumen of the bladder. I told you that the cause is the hypertrophic glands, which is responsible for an enhanced production of mucus, excessive mucus production, and it's a surprise during the ultrasound examination in very many cases. Regarding the ultrasound feature or appearance or pattern, it appears, I told you, somehow as a kiwi-shaped or pattern image, an enlarged gallbladder because of the thickened and with a high consistency bile. Okay, the gallbladder appears enlarged with dilated bile ducts, of course, and when the gallbladder moves, this content, the gallbladder content, is fixed. The treatment, recommended treatment, is a cholecystotomy with antibiotic support. Is not recommended to try in such cases to make puncture, even using or follow ultrasound control, or using controlled biopsy using ultrasound technique. As you see, the gallbladder wall is very thickened, up to 14 millimeters. In case of, or regarding the clinical expression, we can say that the palpation of cranial abdomen, okay, express pain, the presence of pain in many cases in affected dogs. Some of them, okay, can present fever, and of course, even ascites can be registered, of course, and the presence of shock and tachycardia, in addition to pale mucous membranes and of a reduced capillary refill time, can be registered in many cases. Regarding the laboratory exam, okay, are all these changes, the pathogenetic or the physiopathological changes, or all these pathologic conditions are not specific for the presence of the mucocell or the gallbladder mucocell. And I can say, after my more than 28 years of clinical activity, is indistinguishable from those seen with other hepatobiliary or gallbladder disorders. Some of them, and the most common laboratory changes, are reported to hyperbilirubinemia, somehow and sometimes increased levels of the activity of the transaminase activity. And in some cases, we can see a leukocytic response, neutrophilic leukocytosis, but this one is inconsistent registered in our patient. But in case of urine analysis, in some cases can present bilirubinuria. It's important to know the stages. Okay, the stages of the mucocell, you know, the final stage. You see here the normal anechoic content of the gallbladder. After that is followed by a specific pattern. Okay, the specific pattern of kiwi fruit-like pattern. And after that, of course, in addition to the presence of the residual central echoic bile and specific kiwi fruit-like pattern. In my own study case, I can say that in this patient, for example, it's a recent case. I registered an important elevation of the activity of the transaminase activity, a mild activity, the presence of the cholesterol, the biliary salts, an important value, increased value of cholesterol, more than normal value, more than 220 milligrams per deciliter. In our case, more than 500 milligrams. Of course, triglycerides elevated and so on. But the clinical expression, it was dominated by the presence of vomiting syndrome, a tendency of gaining weight, and of course, inconsistency of feces composition. Few words about the tumors of the gallbladder, last medical condition. The tumors of the gallbladder can be classified as benign and malignant one. In first case, we can talk about the gallbladder adenoma, leiomyoma, and in case of malignant, we can talk about the gallbladder carcinoma. Regarding the gallbladder carcinoma, of course, the tumors of the gallbladder are ultrasonographical described as unhomogeneous and alternate hypo and hypoechoic pattern of the gallbladder wall. But remember and notice that the diagnosis of the biliary tumors can be only made through histopathological exam. In such cases, the ultrasound is important. It's really important for guidance in case the process of biopunction of the affected tissues. As you can see in our patient, performing ultrasound guided puncturing of this mass from the gallbladder wall. We've performed in order to have specific cytopathological exam. We performed this echo-guided puncture. Okay, but try to understand, it's not recommended. It's a malpraxis condition to perform in case of cholecystitis. In case of mucocell, it's not recommended to perform echo-guided puncture. but can be in some cases, but with many risk factors in cases severe chronic or recurrent gallbladder inflammation. I'm sorry that I'm late with my presentation because it was more than 1 hour, and I would like to thanks to my colleague for paying attention, for attendance at my presentation, and I'm here for your questions.
I could have stayed more. I could have stayed more. It was really capturing, so I could have stayed more.
You, but not probably not the other colleagues also.
Nah, I'm pretty sure they would have loved to stay more. Yeah, and we have messages. Thank you. Not too long at all. We have at least 2 questions for the moment, and a lot of thank yous in the chat area. And of course, we have the first question will be from the Q&A section from Alexandra Nasta. What is your opinion about the deoxyursocholic acid?
Sorry, can you repeat the question? I can.
Yep, just
don't see.
1 second. Yes, we are now live. So Alexandra Nasta is asking, what is your opinion about the deoxyursocholic acid?
Okay. Thank you. Excellent, Alessandra. Thank you for your question. I told you before that regarding the chemical composition, of the gallstones and of the mud, of the non-specific changes of the content, biliary content. Also, of course, this type of biliary changes or this content, abnormal content, can be responsible for developing this medical condition. But it's important to, from my point of view, in order to have this diagnosis, of course, it's very, very difficult. It's very difficult to have this final diagnosis. But the literature says that from etiopathogenetical point of view, as a main cause can be registered. But from clinical point of view, the clinical expression is similar to all other medical conditions of the gallbladder disease. Especially regarding the content of the wall too, and also regarding the treatment, the normal treatment, dietary, I told you before, choleretic, cholagogue, and cholecystokinetic drugs can solve this problem. But the diet is the most important from this point of view. Thank you. Other questions? I can see 4 questions on chat. No
have questions on the chat.
Did you know? Okay, I saw let's see, the first. I would like to start with the first one. Ok, se aude, yes, ok. Nu-l aude, nu-l mai vedem pe domn profesor, să dăm întrebări. Ok, monitor, așa. Let me see. Did you notice gallbladder stasis and splanchnic ischemia in young dogs suffering from anaerobic diarrhea? Sincerely, to be, I didn't have in mind to, probably I didn't try to make a correlation between the gallbladder stasis and splanchnic ischemia in dogs with anaerobic diarrhea. All my colleagues, and probably all my colleagues, are in accordance with my opinion that after coprobacteriological exam, we have the responsible, the etiologic agent. We are able to treat and in order to offer the specific antibacterial drug. But it's important to notice that regarding the cholestasis, in most of them, all the patients which did not eat for 12 up to 24, and of course during the days, of course we can register the cholestasis, and this is why the gallbladder stasis or cholestasis is registered in a lot of medical condition. I can say so from this point of view that I see ultrasound results or ultrasound examination results from my colleagues which are dealing with ultrasonography, and their diagnosis is gallbladder stasis. No, gallbladder stasis or the dilation the gallbladder is registered in all medical condition when the activity of the gallbladder it was not registered, when the animal is not feeded in case of anorectic patients, in chronic patients, in chronic medical condition patients, and this is only an image. Okay, this is only a condition, but a not medical condition. It's an aspect of the gallbladder, but not a medical condition itself. Thank you. Let's see. Okay, let's see. Thank you. Let's see. What kind of food is more appropriate in order to avoid gallbladder disease? Thank you. For your question. Oh, raw and raw. I know it's a very, it's a tricky and very. I'd like your question, but it's important to notice that the normal recommended for each type of age, for each type of physiological condition or pathological condition, it's important to be recommended. But in all the cases, a low-fat diet, for sure, will be followed by this type of medical condition. Doesn't matter if we are talking about biliary sludge, cholelithiasis, stones, especially, for sure. When we will have a good flow, a good medical composition, the chemical composition of the bile, for sure you willn't register this type of changes. Okay, let's see.
I may interrupt you.
Sorry.
Interrupt you. No problem. But Christina's question just raised the ball. And to be honest, I see more and more dogs with barf diet. I'm not against barf diet, let's be honest. All people have choices. We cannot stand against them. But to be really honest, barf diet will be as harmful to the organism as we do the Dukan diet in people. So to be honest, barf diet would be really good if you will follow your doctor's advices every week or every month. So that's a good plan for us, but not a very good path. So let's be honest, barf diet is really challenging to the organism.
And the chronic patients, thank you, Alex, and the chronic patients are very important for us. Believe me, I told you, because in my discussions with my students and with my colleagues, I would like to remind them all the time that the chronic patients are the most important for our income, for our praxis, for our business, because starting from the diet, continuing with the specific continuous evaluation, clinical evaluation, ultrasound evaluation, biochemical evaluation, recommending them diet, okay, and all these are very important in order but try to understand that in such cases, especially regarding to our subject, if you are a good consultant for the owner, you'll be appreciated, and also you will have a consistent income when you will manage correctly this type of disease or diseases, all these medical conditions. I would like to make a separate distinction between the tumors, but in all other cases, starting with sludge, inflammation, small stones, and all these, of course, and all these changes, morphological or physiological changes, hypomotility, or other medical conditions can be treated starting for a few weeks and months of diet and continued with medical treatment and so on. I see a question, very important here. How often is Giardia involved in gallbladder inflammation? Very often. In my whole activity, I couldn't have such a deeper evaluation of these cases of cholecystitis in order to say, but the specific literature present a lot of articles, a lot of papers, and these connections responsible for the gallbladder inflammation in dogs. Thank you.
We have 3 more questions. One is from Alexandra Nasta. How can we differentiate hypotonic from hypertonic biliary dyskinesia?
Using ultrasonography, having in mind clinical expression, because in case of hypertonic biliary dyskinesia, of course, the pain is more intense after starting with a simple palpation and continuing with, I told you before, having in mind the scintigraphy where it's possible, or using simple ultrasound machine. Okay, and of course, in case of hypotonia, the functional changes are very important. Starting with the feces aspect, the final stage, and the total or the type of digestion, the complete digestion, all the type is not well correlated with this hypotonic. But in case of hypertonic, the spasm, the colic, and the aspect and the bile flow can be very well evaluated using these techniques. Okay.
One question from Daniela: do you rather or prefer commercial diets or homemade ones like rice and chicken, especially in acute cases?
Daniela, you want to kick my ass? My sponsor for today. It was a joke. Okay, I'm sorry. All the time I'm joking with my colleagues and with my students too. Of course, you know, probably it's okay. Alex told me that the floor is mine. Of course, both of them are very effective and very efficient in case of normal patients or in case of diseased patients. But try to understand that nowadays, all the owners or most of them, for them is much more easier to recommend diets, specific diets, and on the other hand, you can stay, okay, let's see for this type of protein, this type of carbs, this type, and so on. In addition to this, and probably it's much more easier to offer and to recommend the specialized diets. But of course, a well done home food can be useful. The surgery is working in cats as total. I'm not a surgery. I'm an internal medicine professor, and I'm an ultrasonographist. Okay.
I can answer.
I will ask to my colleague to follow the diagnosis.
One of my favorite surgeries. So to be honest, after we have a very good diagnosis and we have here the right person to do it, after we have the right diagnosis, the surgery is one of the best choices. So if it's a surgical case, yeah, don't ever hesitate to do it. But as I always told you, the best timing to do a surgery is when you have a stable patient on the table. So don't rush into the surgery room. Just stabilize the patient, and after that you can go to surgery. But yes, surgical removal of the gallbladder, it's one of the best choices you have, and especially in cats, it's like 25-minute surgery, and it's really easy, and it's in hand, and I've done a lot of them, and it's a good choice. Thank you, Razvan, for the question. That was a really good question.
You see, the surgeon is easier, the easiest way for the surgeon. Thank you, Alex, for your intervention, for your and.
Yep. So, guys, I think this is the night. Thank you so much, Professor Codreanu. I know it was short, but intense.
Thank you.
You have a message here. For now, this is my favorite professor on webinar. So you have a #1 fan here, and you have a message here in the chat area. Thank you guys for coming from all over these countries. 31 countries all over the globe. That's good. Hundreds and hundreds of people. Thank you again, Professor Codreanu, from our faculty, faculty, one of our best professors in the university. Thank you again for all your knowledges. Thank you guys for being with us. Thank you for tonight, and hope to see you all in good shape. Stay safe. Good night, guys.
Thank you. Have a good night to you, to all of you.